So we know that language samples are important for our assessment. We also know from the research that there is a large chunk of speech pathologists in our field who don't use language samples.
No. No.
And one of the reasons that people say they don't is because it's time consuming. What are some of the tips that you would give to a speech language pathologist who is starting to use language sampling in their assessments?
I think the first thing is to acknowledge the concern that speech pathologists often express about language sample analysis. And I'm not going to claim that I know exactly where it's coming from all the time, but I think there is part of this is based on how people were potentially trained to conduct language sample analysis when they were graduate students, which may have been this last year, it may have been 10 years ago or 20 years ago, right? So, I think the procedures for collecting language samples really haven't changed that much. But the tools that we have available now to assist with the analysis piece of it have made quite a bit of progress, including like the time that I've been in the field. I've seen a lot of progress in that area. So for someone who's just starting out, who's considering, do I really want to do this? And, I know how busy SLPs are. I know how limited their time is given everything else they have to do. But I think, there's two ways to think about this. One is within the context of assessment, and then within the context of progress monitoring once you're providing intervention, right? So in those two contexts of our clinical practice, I think there's definitely a place for it. On the assessment side of things, it's again going to make your assessment much more well-informed, right? And so when we are talking about conducting assessments that we feel are valid, that we feel quite comfortable in making a diagnostic decision based on these assessments, ideally what we're doing is that, and I've written about this with colleagues, we're using a convergence evidence framework, right? So we're kind of not using like one tool, right? So we wouldn't use just language sample analysis, or we wouldn't just use a standardized test. We would really want to use, ideally, probably at least 2 to 3 sources of diagnostic evidence and see if they pattern together, right? See if they cluster together. So, and language sample analysis is one of those pieces of assessment that we know is critical. The concern about how much time it takes is a valid one. It requires about 5 minutes of the kid speaking. And if you do it in 2 languages, then that's really like 10 minutes. So in terms of contact time, how much time it's going to take up in your assessment, it's going to be like 10 to 15 minutes total, right? The analysis part is what follows, which is you're probably going to be doing that afterwards, right? I think there are tools now that can help. The protocol that I'm going to recommend for people to consider looking into and ideally trying to use is a narrative retell language sampling protocol that, again, it takes the kids about 45 minutes to tell these stories. So when you have to transcribe it, you're transcribing about 4 to 5 minutes of language production. The more you do it with more kids, you become more efficient at it. You do it faster. It's not like you do it in it's not like a 1-for-1 minute equivalent, but you do get more efficient. So the time spent in transcription, I'm going to say, is probably around 20 or 30 minutes. The analysis piece, depending on what you're using to analyze, could be almost immediate.